Hawaii.
Madam President, I rise today in proud support of the Right to Contraception Act, straightforward legislation that would protect individuals' right to access contraception and providers' right to provide it. Our bill wouldn't force anyone to take or provide contraception if they don't want to, but it would help ensure that those who do can without the government getting in their way. As Republicans continue their assault on our fundamental reproductive rights, this bill is critical to safeguard the right of all Americans to access contraception. I look forward to saying more about this important legislation later on, but first, I'm glad to be joined by many of my Democratic colleagues who will come to the floor to speak on this bill. They know how vital it is that we protect the right to contraception. Starting with my colleague from Massachusetts, my partner on this bill, Senator Markey.
Madam President.
Senator from Massachusetts.
Thank you, Madam President. Thank you to my partner, Senator Hirono from Hawaii, and to all of the senators who are going today to lead on this issue of ensuring that people in the United States have access to contraception. We're joined by Senator Smith from Minnesota, but we'll be joined by so many others out here on the floor because this Friday, June 7th, will be 49 years since there was a decision made in the Roe versus Wade question before it got repealed in 2022. 49 years from 1973 to 2022. And the Supreme Court, 59 years ago to this day, June 7th, the Supreme Court recognized the Griswold versus Connecticut, the right for Americans to use contraception. Just a few years later, in 1972, the Supreme Court expanded on that holding and wrote, if the right to privacy means anything, it is the right of the individual, married or single, to be free from unwarranted government intrusion into matters so fundamentally affecting a person as the decision whether to bear or beget a child. That was the Supreme Court in 1972. And recognizing the fundamental right to contraception, the Supreme Court affirmed what we know: the right to contraception is essential to Americans' health and freedom. This decision was a step towards freedom and away from decades of reproductive coercion rooted in this nation's history. In 1927, the Supreme Court in Buck versus Bell approved forced sterilization in a decision steeped in ableism. Federal funds were used to sterilize 100,000 to 150,000 women, half of whom were black, teaching hospitals in New York and Boston experimented on black and Puerto Rican women as practice for medical students. In recent history, immigrant women in detention face forced sterilization, and black and brown and immigrant and disabled, LGBTQ, low-income and rural Americans still face significant and sometimes insurmountable barriers to getting reproductive care. Left up to the extremism of the far right, they would let this injustice grow deeper into the American soul. Just 2 years ago, the Supreme Court majority did so when they took settled precedent and placed it on shaky ground. In Dobbs, the Supreme Court majority overturned decades of settled precedent to strip away the constitutional right to abortion. On June 24, 2022, Americans had one less right than they did on January 23rd, 2022. In his concurring opinion in Dobbs, Justice Clarence Thomas distilled the threat to American freedom. He outlined a long-held right-wing reactionary belief that Americans had too many privacy rights under the Constitution, that the Supreme Court erred in recognizing those rights, and that the court should take them away. The rights he was talking about, the right to marry who you love, the right to contraception. Justice Thomas put that in his concurring opinion, a preview of what he wanted the Supreme Court to take up in future years. Emboldened by the Supreme Court, states across the country have limited or prohibited access to contraception. Texas Republicans gutted Medicaid coverage of emergency contraception. Idaho Republicans blocked health clinics in public schools from providing contraception. And Republican governors are vetoing state efforts to protect the right to contraception. The threat to contraception is not hypothetical. It is a real threat that requires a real response here on the Senate floor. We must guard against efforts to oppress, suppress, and repress reproductive freedom for people and their health care providers. That is why I proudly introduced the Right to Contraception Act with my colleagues Mazie Hirono and Tammy Duckworth. The Right to Contraception Act guarantees Americans have the freedom to get contraception and for health providers to give it, the right to contraception free from federal and state government threats, and the dignity to choose what contraception works best for them and for their families. Passing the Right to Contraception Act would provide clear and unequivocal safeguards for a right that Americans have relied upon for nearly 60 years. It would keep government intrusion out of the deeply personal decisions people make about their health and their families. It would mean moving towards reproductive justice and freedom for everyone in our country. Now, my colleagues across the aisle are trying to argue that this legislation restricts parental rights and religious liberties. That is completely untrue. The only restrictions that are being debated today are the ones Republicans and MAGA extremists want to place on access to contraception. Democrats are here today to defend reproductive freedom. This bill is about ensuring liberty, the liberty that comes with having full access to health care options. Today, we have an opportunity to pass an historic piece of legislation, the Right to Contraception Act. This vote asks a simple question of each senator and each American. Do you support Americans' freedom to make their own decisions about their health and social and economic freedom or not? Which side of that question are you on in our nation? For many of my colleagues and for the vast majority of the American people, that answer is easy, and it should be easy. At its best, this institution has affirmed the rights of every American. On this floor, we have expanded access to health care, battled against racial segregation, and protected same-sex marriage. And today, we have the opportunity to protect the right to contraception. We have the opportunity to show the American people that we will fight with them and for them for reproductive freedom. I urge my colleagues to join me in voting yes to pass the Right to Contraception Act. Vote yes to ensuring that reproductive health, freedom, and justice is the law of our land. We cannot allow our country to go into the Wayback Machine, to go back to 1965, to go back to before Griswold was decided. That's what MAGA right-wing Republicans want to have happen in our country, and it is just absolutely unacceptable. So today is the day of reckoning. Today is the day we will have the vote out here on the Senate floor to show which direction you believe our country should be heading. I thank Senator Schumer for making it possible for us to have this debate today. I think it is going to be a very meaningful one that will ultimately help to clarify for the American people whose side each of the senators are on in terms of their families, their family planning, the decisions they have to make for themselves. So I thank you. I thank Senator Hirono and Senator Duckworth for their leadership. Senator Murray, of course, a historic leader on all of these issues. And I'm looking forward to the discussion, the debate today. And I yield back.
Senator from California.
Madam President, I rise today to join my colleagues in calling for the passage of the Right to Contraception Act. I'd like to start, of course, by thanking Senators Markey, Hirono, and Duckworth for their work in championing legislation that preserves women and families' right to plan pregnancy on their own terms. Now, basic reproductive and sexual health care tools like contraception, like STI prevention, and like fertility treatment are under immediate threat, further reducing patients' options on when and whether to start or grow their families. In Arizona, every Republican in both legislative chambers blocked legislation to protect access to contraception. In Oklahoma, we've seen the Republican legislature there advance legislation that could create a database of women who've obtained an abortion and could make IUDs and emergency contraception inaccessible. In Tennessee, House Republicans voted down a bill in committee that would have made clear that the state's abortion ban would not jeopardize access to contraceptive care or fertility treatments. In short, Madam President, at every opportunity, extreme MAGA Republicans haven't stopped their unconscionable campaign to chip away at a woman's access to basic health care. According to 2022 data from the Kaiser Family Foundation, 90% of females aged 18 to 64 have used contraception at some point during their reproductive years. 90%. If we were to let those extremists have their way, it would mean millions of women in our country being left without options and forced into unwanted pregnancy and other situations that we may not be prepared for. Now, my state, California, has been a leader on the front lines of reproductive freedom. 5 months after the Dobbs decision, California voters overwhelmingly chose to amend the state constitution and unequivocally protect the right to abortion and contraception. This week, I heard from Martin Areu and Emily O from Southern California, first-year students attending Santa Monica College and Irvine Valley College, respectively. Together, they serve as the Youth Health Equity and Safety Ambassadors for Essential Access Health, a nonprofit dedicated to championing quality sexual and reproductive health care for all. They wrote to me saying, quote, "Access to contraception is not just a health issue. It's a lifeline for our autonomy and future. Access to contraception is about giving us the power to shape our destinies. When we have the tools to manage our health, we can stay in school, build stable families, and contribute positively to our communities. The ability to get contraception enables us to lead healthier, more productive lives and achieve our dreams. It's about fostering personal responsibility, stability, and economic self-reliance." Madam President, when I came to this chamber, I made a promise I made a promise to be urgent in my efforts to protect the rights of young people like Martin and Emily, and others in their generation who are tired of being ignored and dismissed. We cannot fail them or let them down in this moment. I close urging my colleagues to join in and ensure that attacks on contraceptives do not go unchecked. We must support this legislation and safeguard contraceptive care for the millions of young girls, women, and patients across the country. Thank you, Madam President. I yield the floor.
Madam President.
The senator from Minnesota.
Madam President, I rise today with my colleagues to urge all of my colleagues to vote in favor of the Right to Contraception Act. So, at its core, this bill is based on a very simple value that the value is that every individual should have the right to make decisions about their lives, their medical care, their family, and their bodies. And passing this bill would not only protect the right to get birth control free from government interference, but it would protect this core American value. Because if you don't control your reproductive life, you don't control anything about your life. So this is a bipartisan issue, at least in the nation, if not in this chamber. Over 80% of Americans support access to birth control, including over 70% of Republicans. But despite this overwhelming level of support, many of my Republican colleagues seem set to block this bill today. And, I wish I could say that I was shocked, but there is a direct through line we see between Senate Republicans and Donald Trump confirming Trump's extremist anti-choice justices, overturning Roe, and bringing us to this day. So this is not an accident. This is a plan. And in the era of chaos ushered in by the Supreme Court's Dobbs decision, Republicans' refusal to protect access to birth control is just another example of this cruel and reckless approach to women's health. And every day, we are confronted with the grave consequences that overturning Roe has had for Americans. Today, 1 in 3 women of childbearing age live in states with a Trump Republican abortion ban. And from those states, we hear the stories of the impact of that on people's lives. Women trying to get reproductive health care and being turned away, sometimes until their condition becomes life-threatening. Doctors trying to provide health care that they feel is best for their patients, but they can't because of fear of prosecution. And it is clear that the people responsible for this either don't understand women's health and bodies or they just don't care. Now, people access contraceptive care, birth control, for a whole host of reasons, including to treat conditions like ovarian cancer, endometriosis, and migraines. And laws and regulations that restrict access to birth control, they harm people. They harm people and they harm their families. And that is why this is so important. The Right to Contraception Act protects more than just your right to make your own decisions about whether and when and how to become a parent. It protects your right to chart the course of your life and to make decisions without politicians and judges interfering. So when Republicans vote no, what they are saying is that they want to be in charge of your freedom, your autonomy, and your personal dignity. So, you may be thinking, as you're listening to this debate, why is this law necessary? What is out there? Who is out there that is actually trying to restrict access to contraceptives? Well, the reality, colleagues, is that this is happening. You can see it in Republican efforts to redefine some contraception like IUDs or the morning after pill, to redefine those kinds of contraception as abortion, based not on the science, not on the best medical expertise, but on their political views. You can see it in the relentless efforts to defund Planned Parenthood and to cut Title X funding. Now, colleagues, Title X is the bipartisan law that was signed by President Nixon. It is the only federal program dedicated to providing comprehensive family planning and preventative health care. Title X helps low-income people afford wellness exams, cervical and breast cancer screenings, testing for sexually transmitted diseases and HIV/AIDS, and it also provides basic infertility services. It is a godsend for over 2.5 million Americans, most of them without any health insurance and under the age of 30. And we should be supporting Title X and not tearing it down. Now, many of you know that long before I came to this body, I worked at Planned Parenthood. And when I was there, I saw every day what it means to get access to basic reproductive health care, how that frees people to be able to live the lives that they choose, and how much they depended on those services. Now, Donald Trump and extreme Senate Republicans have created a health care crisis by banning abortion for 1 in 3 women of childbearing age in this country. And if my Republican colleagues are really interested, truly interested in helping women and families, you would vote for this bill, this Right to Contraception Act. You would vote for it today. And I'm here to tell you, actions speak louder than words. A no vote means that you don't trust women to make our own decisions about our bodies, our health, and our lives. And so I urge you to join us in voting yes. Thank you, Madam President. I yield the floor.
Madam President.
The senator from Hawaii.
Madam President, for years people were accused of being hysterical for saying Republicans would actually take away people's reproductive freedoms. The prevailing Republican position to ban abortions in almost every instance with no exception was so outrageous, so cruel, so unpopular, people said, well, they would never actually go through with that. But 2 years ago, it finally happened. Roe fell and tens of millions of women across America lost their right to reproductive freedom overnight. And now, once again, people question whether Republicans will actually go through with the thing that they say they want to do. It's too morally extreme, it's too politically risky, but the fact is, Republicans have shown no restraint whatsoever when it comes to shredding people's reproductive rights. Overturning Roe was never going to be enough. The project also includes banning birth control and IVF. It doesn't matter how outrageous it is. It doesn't matter how unpopular it is. It doesn't matter that 92% of Americans support birth control and almost 90% of women have used it at some point. It doesn't matter that women and families would lose the ability to plan whether and when to have kids. Dismantling reproductive freedoms is central to the Republican agenda. Aside from tax cuts for billionaires, it's kind of their main thing. No right or freedom, no matter how basic or popular, is off limits until Congress enshrines that right in federal law. The Right to Contraception Act does exactly that. It enshrines in federal law the right to birth control, and it protects doctors who are simply doing their jobs by providing it. This should not be controversial. No matter where you stand politically, if you want several kids or you want none at all, whether you're religious or an atheist or somewhere in between, this is about the basic principle that people ought to be able to decide what's best for themselves, their bodies, and their families. And yet, over the past 2 years since the fall of Roe, Republican lawmakers in at least 17 states, Nevada, Arizona, Virginia, Wisconsin, Louisiana, have repeatedly killed efforts to protect access to contraception. And Republican-led legislatures in states like Missouri and Idaho are pushing bills to block access to various forms of birth control, including Plan B and IUD. All the while, you have Donald Trump openly toying with a national contraception ban. So to say the future of birth control in the United States is in serious jeopardy is not partisan spin. Republicans continue to work at this goal. They want fewer rights, less autonomy, less freedom. And the only way to counter their crusade against people's fundamental freedoms is to enshrine this right in federal statute. And the really cool thing about the Senate floor is this. This is the place where you find out what people actually think. There was a memo from the NRSC, interesting memo. A lot of people are talking near the train to the media about what they think about contraception. But in 2 hours, we get to know what you think about contraception. We get to know whether you actually want to enshrine this right in federal statute or you don't. That is the beauty of this place, and that is the beauty of this bill at this time. Everyone will go on the record. I yield the floor.
The senator from Washington.
Madam President, thank you. I want to thank all of my colleagues who are here on the floor and Senator Hirono, who has led this legislation along with Senator Markey. As you just heard today, every senator is going to be confronted with a very simple question. Should Americans have the right to contraception, the right to birth control, IUDs, Plan B? Now, that really should not be a hard question. In fact, most Americans thought this matter was settled. After all, nearly 60 years ago, the Supreme Court decided Griswold versus Connecticut and affirmed Americans' right to privacy, including the right to contraception. And today, the right to contraception is overwhelmingly popular. The vast majority of American people, our constituents, support this right. So this should be an easy vote. This bill should pass with flying colors. It almost shouldn't be necessary. And yet, Republicans have been making clear a bill like this is not only necessary, but urgent. Because not only has Justice Thomas signaled an interest in reconsidering Griswold, not only have senators said Griswold was unsound, but there are Republican bills right now with large GOP support that would severely undercut the right to birth control, like the Life at Conception Act, which is supported by more than half of the Republicans in the House, including the Speaker. That GOP bill would enshrine the truly extreme doctrine of fetal personhood nationwide. That would not just ban abortion. It would outlaw emergency contraception like Plan B, and it would outlaw IUDs. You don't have to take my word for it. I chaired a HELP hearing yesterday on the damage of Republicans' anti-abortion attacks over the past 2 years. And I asked the Republicans' own witness directly, do you view IUDs as abortion? The answer was yes. Let's be crystal clear. IUDs and Plan B do not cause an abortion. That level of disinformation is chilling, and it cuts to the heart of the issue about what many Republicans really think about contraception. So every time Republicans try to say no one is coming for your birth control, well, what about every Republican pushing for fetal personhood? Seriously. And let's say Republicans succeed at making fetal personhood the law of the land. I mean, they already succeeded at overturning Roe. So if Republicans enact fetal personhood, what happens to all the women with IUDs? Make no mistake, that isn't simply some provocative hypothetical. If Republicans actually pass the Life at Conception Act, this is a question millions of women will have to grapple with. Now, I don't expect an answer from Republicans, and I don't expect every Republican to be as forthcoming as their witness yesterday when it comes to where they stand on the right to birth control. But we are putting every single senator on the record today when we vote on the Right to Contraception Act. This bill is exactly straightforward and common sense as it sounds. It simply codifies Americans' right to birth control into law. That's it. And you don't have to take my word for it, read it. It's 11 pages. Madam President, to me, this is not just a messaging bill. It is a meaningful way to protect a really fundamental right. But it is absolutely right that how each of us votes will send a message. So what message do my Republican colleagues want to send the American people? What message do we want to send our constituents? That we support their right to birth control? That we support access to IUDs, to Plan B, or that we're okay taking that right away and letting politicians make medical decisions for women in this country? I know where I stand, with the overwhelming majority of people who support that right. And soon we will know exactly where every Republican senator stands as well. And Madam President, whatever happens with this vote, Democrats are going to keep pushing full force to hold Republicans accountable for their extreme policies, the harm they are causing, and we will work to restore abortion rights in this country and protect women's reproductive rights across the board. Thank you, Madam President. I yield the floor.
The senator from New Hampshire.
Madam President, I am here today with the same concern that we've heard from my colleagues, that this country is failing women in New Hampshire and across the country when it comes to protecting our fundamental freedoms. Fundamental freedoms like the right to contraception, which we thought was safe just a few short years ago. From the beginning, the right to full access to contraception was hard fought. Since that right was first recognized by the Supreme Court in Griswold v. Connecticut nearly 60 years ago, to the Affordable Care Act's expansion of contraceptive coverage in 2010, requiring insurance companies to pay for it, there have been incremental yet vital steps forward for women to determine our own reproductive futures. It put us on a path to making sure our daughters and granddaughters had more fundamental rights, not fewer. But as of so many things, this progress has been met with resistance. In the years since the Affordable Care Act, attacks on contraception have increased at both the state and federal level. Like many Americans, like those of us here today, I was very alarmed when I heard when Justice Thomas wrote in his concurring opinion in the Supreme Court's Dobbs ruling that the court should reconsider its ruling in Griswold v. Connecticut, should reconsider women's rights to access to contraception. That's my editorial analysis of what Justice Thomas was saying. And then, of course, just last month, the former president, Donald Trump, implied that states should be allowed to decide access to contraception, potentially setting a dangerous precedent that would harm millions of women and families who rely on contraception. And we heard Senator Murray talk so eloquently about how the laws are being interpreted to raise concerns about access to contraception. And as Senator Schatz said so well, we've heard people suggest that our concern about access to contraceptives is really a scare tactic. But for all of us who worked for years trying to protect Roe v. Wade and the right for women to make our own health care decisions, we heard that same argument for decades on the Roe decision. The Supreme Court's never going to overturn that. We've already heard the justices say that's settled law. Well, we saw what happened in the Dobbs decision. And these threats against women are felt acutely in my home state of New Hampshire, where our critical family planning providers can't make ends meet because elected officials continue to block federal and state funding vital to ensuring that Granite Staters have access to reproductive care. And that care doesn't just encompass contraceptive services, though that's critically important, but it also includes basic reproductive education. It includes things like breast cancer screening and sexually transmitted disease screenings and treatment. And by throwing up roadblock after roadblock, MAGA Republicans are showing that they don't really care about women's health or our personal freedoms. They're taking us backward when women want and deserve to go forward. And these efforts follow a concerning pattern, that women's rights are negotiable, that they can easily be taken away, and that women's lives and our freedoms to decide our own futures are not valued. So to address the women and families who are on the front lines of this partisan onslaught, let me just say that I understand the anxiety, the fear, and the hopelessness that comes from watching your rights be stripped away. To Zoe, who's a recent University of New Hampshire graduate, she wrote so powerfully about the positive experience she had with a family planning provider in New Hampshire. She said, and I quote, "Without access to birth control, decisions about my future would always have an element of uncertainty lingering." But because Zoe had access to a family planning provider, she was empowered to make her own decisions, to have control over her own future. And to the women in New Hampshire who have written me to say, For example, I'm worried about which rights will be taken away, or I feel that women don't have equal rights. And how did it come to this? To the women not ready to start a family, to those whose family is just the right size, and to all of the young women like my granddaughters who have fewer freedoms now than their mothers did at their age, I say to you, I hear you and I feel that pain. As we vote today, history is watching us. We can't sit back and watch while reproductive freedoms backslide, because access to contraception is a fundamental right, and no one, not a sitting Supreme Court justice, not a governor, not a member of Congress, should be allowed to decide whether or not a woman chooses to use contraception and determine her own future. That highly important and deeply personal decision belongs to the woman and her family, to the woman alone. With that, I yield the floor.
Madam President.
The senator from Michigan.
Madam President, we are living through a new era in the fight for reproductive freedom. This month marks 2 years since the extreme conservative majority on the Supreme Court struck down Roe versus Wade. This decision, which was enabled by Donald Trump and my Republican colleagues, has been an absolute disaster for our country. Republican lawmakers have stripped abortion access from millions of women. They have made clear that they won't stop until they get a national abortion ban. And this is all part of an extreme agenda that will go even further. A mission to take away basic freedoms for women all across our country. We have to step up and protect reproductive health now. Contraception could be the next frontier in that fight. Republican governors in Virginia and Nevada have vetoed bills to protect access to birth control. The Arizona legislature has blocked similar legislation. And that's why I'm proud to be a co-sponsor of the Right to Contraception Act. This legislation is very simple. It guarantees every single American the right to access contraception and ensures that healthcare professionals can provide it without interference from extreme Republican politicians. Birth control is a pillar of reproductive health care. It's safe, it's effective, it gives millions of women control over when they want to start a family, and some contraceptives have an array of other health benefits, from helping to prevent certain kinds of cancer. Birth control also helps expand economic opportunity for women all across our country. Access to birth control is linked to better educational outcomes, more professional opportunities, and higher lifetime earnings. For all those reasons, access to contraception is an issue with an overwhelming bipartisan support. More than 90% of Americans believe that everyone should be able to access the contraceptives that they need. We must take every measure to prevent dangerous bans on birth control, especially because barriers and access disproportionately impact our most vulnerable communities. Black, Hispanic, low-income, and uninsured women are more likely to have issues assessing and affording contraception. Every person should be able to receive this essential care and have the freedom to plan for their future however they see fit. I call on my colleagues to vote in favor of the Right to Contraception Act. Republicans are bent on taking away reproductive freedoms for women everywhere, and we need to stop them from turning back the clock. We should also not stop at contraception. We must work to expand access to all sexual and reproductive health services. And that means abortion, contraceptive, gender-affirming care, maternal health care, and so much more. Starting a family is one of the most important and clearly one of the most personal decisions that a person can make. And politicians should be absolutely nowhere near it. Let's guarantee women have the reproductive freedom that they deserve. Madam President, I yield.
Madam President,
Senator from Michigan.
I rise at a very serious moment in our history, and I want to thank Senator Hirono, Senator Markey, all of our colleagues for joining together in really not only speaking out, but standing up for women across the country, for families, for everyone who wants the capacity to have their own freedom to make their own healthcare decisions, their own personal decisions about their lives. That's really what this is all about. Let me first back up in the big picture, because we know for 50 years, Roe v. Wade protected our freedom to make our own health care decisions. Then 2 years ago, because of a new Supreme Court majority appointed by Donald Trump, gone. I was a college student when Roe v. Wade was decided. I can't believe that women today, that my daughter, that my granddaughter may, as she grows up, have fewer freedoms than I did all those years ago. Today, 21 states now have near total bans or severe restrictions on abortions. That means 1 out of 3 women now live under extreme and dangerous abortion bans, and we know who to blame, because he said it, Donald Trump, MAGA Republicans. He said himself, I was proudly the person responsible for ending Roe. Proud to put the lives of millions of women at risk, proud to take this freedom away. And if you think Donald Trump and Republicans are going to stop there, then you haven't been listening to them. First, their ultimate goal is a nationwide ban. Under a nationwide ban, all of Michigan's hard work, our election to protect our freedoms in the Michigan Constitution that we passed 2 years ago will be gone. None of that will matter, and we can't let that happen. But as we're here talking about today, Republicans have indicated they want to go even farther in their assault on reproductive freedoms. Right-wing judges, Republicans across the country are attacking access to contraception. I never thought, Madam President, in my wildest dreams, I would be standing on the floor of the United States Senate talking about efforts to take away my right, your right, any woman's right, any person's right to make their own decision on when to have a family, on contraception. But right now, in states like Virginia, not very far from here, Nevada, Arizona, right now, Justice Clarence Thomas, as has been quoted on this floor today, has called on the Supreme Court to reconsider the constitutional freedom to access contraception in America. And let's be clear, birth control is a key part of a woman's health care. It's important for reproductive decisions, for treating medical conditions, for decreasing the risk of cancer. And most importantly, it's a personal decision. This is a personal decision. Americans don't want politicians, anybody here, or judges in their doctor's office, in their medicine cabinet, or in their bedroom. They want to make their own decisions. They have every right in America to make their own decisions about their health care, their life, and their future. That's as basic as it gets in America. We talk about the freedoms that we have in this country, and that's pretty basic, to make your own decisions on your own health care. Well, we're here on the floor as Democrats to say, we couldn't agree more. We could not agree more. This is absolutely fundamental. And that's why we need to pass the Right to Contraception Act now. And everybody on this floor is going to have the chance to either vote to do that or not. This critical legislation will guarantee the right, the freedom to contraceptives, a right that was decided by the Supreme Court nearly 60 years ago. We can't let Republicans turn back the clock. We need to defend America's freedom to make decisions about our own health care, our own lives, our own futures. And protecting contraceptives is an essential part of that. It's a basic part of that for us. And that's why we're here. Reproductive freedom is something we should all embrace as a basic American freedom. I hope colleagues will join us in moving forward on this essential legislation. I yield the floor.
Madam President, I rise in support of the Right to Contraception Act. I'd like to thank Senators Markey, Hirono, Marie, and Duckworth for their leadership on this bill. Senator Hirono is here. Senator Cantwell is also with us, who's been such a strong supporter of this bill. We're at a pivotal moment for women's rights in this country. This month marks 2 years since the Supreme Court issued the ruling shredding half a century of precedent protecting a woman's right to make her own health care decisions. This ruling was against the wishes of somewhere between 70 and 80% of Americans who believe that a woman's most personal decisions about her health care should be made not by politicians, but by a woman, her doctor, her family. In the wake of this disastrous ruling, women have been at the mercy of a patchwork of state laws that are creating chaos when it comes to accessing reproductive health care. Since the Dobbs decision came out, extremist judges have attempted to ban mifepristone, undermine IVF, and even criminalize doctors. Legislatures have introduced bills to criminalize doctors for simply doing their jobs. 21 states have fully or partially banned abortion, and the number of U.S. patients traveling to other states for abortion care has skyrocketed to 1 in 5. This is unacceptable. My daughter should not have less rights than her mother or her grandmother. So, what is next? Well, what we must do is to codify Roe v. Wade into law, but as we work to do that, we have something else we have to watch out for, and that is that some Republican political leaders have called for even restrictions on contraception. And in his concurring opinion in the Dobbs case, Justice Thomas actually laid out a roadmap for how the court could overturn the right to contraception. He said that the Supreme Court, quote, should reconsider, end quote, whether the Constitution protects the rights to access contraception. This Friday marks 59 years since the Supreme Court recognized the right to access contraception, but the current court has made it clear that it won't hesitate to overturn decades of precedent in other contexts. This threat is not hypothetical. In the wake of the Dobbs decision, nearly 20 million American women live in what we call contraceptive deserts, where they struggle to access birth control. I'm thinking about Delilah, who lives in northern Texas. There are no health centers in her county and the dozen surrounding counties. To talk to a doctor about birth control, she has to travel more than 400 miles, nearly 7 hours. Or Maya, who lives in Arizona. The wait times at her nearby health centers are so long that she needs to request an appointment at least 3 weeks in advance. And then there's Leah, who lives in Ohio. She has access to a clinic, but to take time off work to go to appointments, something she can't always afford to do. State-level efforts, including recent governor vetoes of right-to-contraception bills, are making the problem worse. We saw this in Nevada and just 2 weeks ago in Virginia. In Wisconsin, we saw the Republican-controlled state legislature refuse to hold a vote on the Right to Contraception Act. And we've seen Missouri and other state legislatures attempt to cut off public funding for widely used contraceptives like IUD and Plan B. While 14 states, including my home state of Minnesota, protect the right to contraception, that is simply not enough. We cannot settle for a situation where women in Minnesota have more rights than women in Missouri. And with so many extremists racing to the state capitals to see who can be the first to take women's rights away, it's clear that we must explicitly protect the right to contraception. The American people agree. Recent data shows that more than 90% of Americans support access to contraception. That's why we are calling on our colleagues to pass the Right to Contraception Act. This legislation is hardly radical. It simply ensures women will be in the driver's seat when it comes to their health by codifying the right to contraception outlined by the Supreme Court nearly 6 decades ago, the same right Justice Thomas and others want to strip away. Specifically, this bill safeguards a patient's ability to seek contraceptions and a healthcare provider's ability to provide these critical services. And because the right to contraception cannot be an empty promise, it gives the Justice Department, patients, and doctors the power to make clear that no one can infringe the right to contraception. I'll note that 2 years ago, the House passed this legislation on a bipartisan basis. It's time for this body to do the same. For the last 2 years, women in this country have faced an unacceptably uncertain future. These attacks on reproductive freedoms, on freedom for health care, have no place in America. Women are not second-class citizens. The bill we're considering today represents a better path forward, a better future. The question is that we must all answer is, will we take that path? Or are we going to turn this over to this Supreme Court, who has created a patchwork of laws that has allowed some states to try to criminalize doctors, who have allowed some states through their courts to ban mifepristone, a drug that has been found safe in dozens and dozens and dozens of countries. We got to decide. So we have an opportunity today to make clear where we stand as a nation. I call on my colleagues to do what the American people overwhelmingly support and pass this bill into law. Madam President, I yield.
Madam President.
The senator from Washington.
Madam President, I join my colleagues out here on the floor. I thank the senator from Minnesota for her unbelievable advocacy on behalf of women and health care and for her constant leadership on this issue. I'm glad to be joined with my colleague from Hawaii, who also has been such a great leader, both of them serving on the Judiciary Committee, the front line of making sure that women's rights are protected. I thank them so much. Most Americans alive probably don't remember a time when they didn't have the freedom to use birth control. I mean, we hear a lot about family planning. Well, what is family planning if you don't have access to contraception? Most people don't remember a time when they didn't have the freedom to decide whether and when to have children. In Idaho recently, they banned abortion. Now several of the state's colleges have banned their staff from even speaking to students about contraception. Imagine college students in the dark about something as basic as a healthcare service. We've heard from a OBGYN doctor from Idaho who moved away from their state after their reproductive care law, like so many other physicians have done in other states. And one thing really stuck out about what she told us. She said the anti-choice activists really stood out to her. She said, because they told her they're not done. After Texas banned abortion, the state's governor said women should just use emergency contraception to avoid getting pregnant. But Texas had already stopped covering emergency contraception under their state family planning laws. Madam President, when they say they're not done, I believe them. In Iowa, the abortion ban is blocked for now, but the state attorney general temporarily paused a public funding program that helped pay for emergency contraception for rape victims. 362 reimbursements have been delayed. Madam President, I believe them when they say they're not done. In Arizona, where abortion rights have been in legal chaos due to a practically civil era war ban, Republicans there unanimously blocked a vote to protect the right to access contraception. In Virginia, people still have abortion rights, but the governor chose to veto a bill to protect and expand birth control access just hours before the deadline. So yes, they're not done. In Florida, where a total abortion ban, near total abortion ban went into effect, lawmakers granted a so-called crisis pregnancy center authority a 5-fold funding increase. These centers pretend to be real clinics while spreading misinformation about reproductive care, including contraception. Across the country, anti-choice organizations are pushing false claims about contraception, fighting the access to contraception, and basically even saying that birth control should be illegal. So they're not done. And that is why we're here today. The Supreme Court took away our constitutional right to abortion, and according to even one justice, they said they're not done. So the point is that a woman, not even sure she can depend on the miracle of IVF to start a family, America needs to know where people in this institution today stand on the reproductive rights of women, of family planning, of giving us access to contraception. Today, in my state, the state of Washington, abortion and contraception are protected by law. But this bill is important to my state because healthcare laws in the nearby states affect our delivery care system. The University of Washington just this week released a study that showed our state's abortion providers have seen a 50% increase of out-of-state patients since the Dobbs decision. This study also found, now if you think about it, if you've seen a 50% increase in out-of-state patients, it means you're seeing more patients. What is the effect of seeing more patients? The study also found that all patients are getting abortions about 1 week later than they were before the Dobbs decision, which is dangerous on the healthcare delivery side. Washington saw the largest increase in patients from those states who had banned abortion, states like Texas and Idaho, Louisiana, and Florida. Now imagine if they carry this further and ban contraception too. Our state doesn't want to be impacted in the delivery of care. It wants people to be able to see a physician when they need to see a physician, get the care when they need to get the care. If we want to keep the right to contraception, if we want to keep the freedom to choose when people want to start their families, if we want to keep OBGYNs in our national network system, we need to codify this right here today. We have to protect this right so the Supreme Court can't take it away. I'm glad to be a co-sponsor of the Right to Contraception Act. I certainly look forward to voting on this legislation and urge my colleagues to do the same. It just seems like not that long ago when our country recognized in Connecticut versus Griswold that we had this right. And when we've been talking about it for the last many years now, really, as so many people came before the Congress to be a nominee for a judicial branch, they all said this is all settled law. Oh yeah, Connecticut versus Griswold. We always ask that question. Why? Because Connecticut versus Griswold was the basis of a decision based on contraception. that gave you this right to privacy. And now, all of a sudden, not only was that ignored by the Supreme Court, it was amazing that when you think about the time before that, people didn't have access to contraception. It became such a day-to-day part of our lives. If it's such a day-to-day part of our lives and the delivery of health care, then we should have the courage to say so and vote this way today. And if people don't, it's because they aren't done, and they don't want to protect this. And I guarantee you, families deserve the privacy of knowing when and how they want to start their families. I ask my colleagues to support this legislation and support our health care system that has been working very well with the support of contraception. I thank the President, and I yield the floor.
Madam President.
The senator from Hawaii.
Madam President, I want to thank all my colleagues who came to the floor of the Senate yesterday and today with the fierce urgency of now to urge passage of the Right to Contraception Act. This month marks almost 2 years since the Supreme Court's disastrous Dobbs decision, resulting in women in half the country have fewer rights than women in the other half of the country. What kind of a country is that? I thought this is a country founded on equal protection and equal rights, not according to this Supreme Court. So Dobbs wreaked chaos in its own right, overturning Roe v. Wade and eliminating a constitutional right that I had for almost 50 years. But it also foretold more chaos to come. In his concurrence in the Dobbs case, Justice Thomas specifically called for reconsidering Griswold v. Connecticut, the 1965 case protecting the right to contraception. When a Supreme Court justice says he wants to reconsider a case, that is a signal that he wants to overturn it. It's bad enough that they overturned Roe v. Wade, 50 years of a constitutional protection. Now, if they want to overturn Griswold, that is a 59-year precedent protecting our right to contraception. We have what I have described as an out-of-control Supreme Court majority that has no problems overturning decades here, there, and just about everywhere based on their ideological agenda. Justice Alito, meanwhile, respects his wife's right to make her own decisions, but he has no problems telling millions of women, the rest of us, what to do with our bodies. I mean, just think about it. Do you see the irony of it? Do you see the hypocrisy of it? And just this year, both of those justices, and I am talking about Justices Alito and Thomas, suggested that the Comstock Act, a Civil War era law, Civil War, I mean, how far back are they going to go? Could be used to restrict access to reproductive care nationwide. This crusade against reproductive rights by these justices and the rest of their cohorts, I have to say, really comports with the Republicans' obsession with power and control over women's bodies. As they work toward a national abortion ban, Republicans and their allies on the Supreme Court have given us every reason to believe contraception is also on their hit list. Republican states across the country have already blocked or rolled back access to contraception. You've heard from my colleagues. Virginia's governor vetoed a right to contraception bill just last month. Earlier this year, Arizona Republicans blocked a similar bill in their state. Oklahoma's legislature has advanced a bill that could ban access to IUDs and emergency contraceptives. The list goes on. They are very specific about the kinds of contraceptives that we should have access to. So this whole desire that I really can't figure out that, on the part of the MAGA Republicans and their supporters on the Supreme Court, which really comes down to power and control over women's bodies. That's what it is. Madam President, contraception is health care, essential health care that millions of people across the country rely on, not only to decide if and when to become pregnant, but also to treat medical conditions, regulate hormone levels, and more. And that's why the vast majority of Americans support the right to contraception. Madam President, the current assault on women's rights is horrifying, but it's not new. Our country has a long and dark history of exerting control over women. For much of our country's history, women were denied the right to vote, a fundamental right to vote. They didn't have a right to own property. They couldn't open bank accounts. The list goes on. Some women of color faced forced sterilization and coercive contraception testing. That is the dark history in our country of controlling women and our bodies. These attacks on women and our freedoms were wrong then, and you would think by now we would have learned a thing or two to protect all of our rights, but not this MAGA majority Supreme Court. And so the attacks we are facing today is a reality. The right to control one's own body, free from government interference, is as fundamental as it gets. That is why it is critical that the Senate pass the Right to Contraception Act. Our bill is simple. It would protect an individual's right to access contraception and a provider's right to provide it. It wouldn't force anyone to take or provide contraception if they don't want to, but it would ensure that those who do can without the government getting in their way. It would ensure people can access the health care they need, from IUDs and birth control pills to emergency contraception like Plan B and more, especially for women of color, women with disabilities, LGBTQ people, and those from rural communities who have difficulty accessing this kind of care. They already face increased barriers to accessing contraception. This bill shouldn't be controversial, but Republicans have become so obsessed with controlling women's bodies that they refuse to protect even the most basic freedoms. To my Republican colleagues, I ask, what's with this obsession with power and control over women's bodies? Democrats know women, not politicians, should be the ones making decisions about our bodies and our health care. And we're doing everything we can to protect and strengthen the reproductive rights of all Americans, including the right to contraception. We are going to vote on this bill today. And I urge all of my colleagues, with the fierce urgency of now, to stop taking away ever more rights of women in this country, women and others in this country, and vote for this bill. Thank you, Madam President. I yield back.
Madam President.
A senator from Nevada.
Madam President, I am thrilled to be joining Senators Markey, Hirono, Duckworth, and all of my colleagues today in support of the Right to Contraception Act. You know, this month marks the second anniversary of the Supreme Court decision overturning Roe versus Wade, which upended a woman's right to choose and paved the way for former President Trump and anti-choice politicians to further erode women's rights in this country. Now, we knew these anti-choice Republicans wouldn't stop attacking reproductive rights after Roe fell. We knew they would keep trying to diminish our freedom to make decisions about our own bodies, including the right to obtain and use birth control. Now, you don't have to take my word for it. Look what's happening in states across the country, as you've heard from my colleagues. Even though the right to birth control has strong bipartisan support, anti-choice lawmakers are passing bills left and right to chip away at access to contraception. And listen to the leader of the Republican Party. Just 2 weeks ago, former President Trump said he was open to restricting women's right to contraception if he wins another term. For the anti-choice right, this is about controlling women. On the other hand, my fellow pro-choice colleagues and I believe in reproductive freedom. We're working every day to protect access to birth control and other basic forms of women's health care, and we're making real progress here. Last year, the Food and Drug Administration approved Opill, the first ever over-the-counter birth control pill. And once it was approved, Senators Murray, Hirono, and I, along with others, pushed the manufacturers to make sure that Opill is widely accessible without a prescription. It's now available online and in stores across the country. We're not alone in this fight. The Biden-Harris administration has worked hard to expand access to contraception and make it more affordable for American women. And we've made important progress, but we've seen that the anti-choice movement won't stop coming after our reproductive rights. That's why we have to pass the Right to Contraception Act and protect access to birth control in every state across our country. We know that despite dishonest efforts from anti-choice politicians to label it as dangerous, birth control is an essential part of health care. And for me, contraception was about my health care, as it is for millions of women in America. And I'll tell you what, to my female colleagues here, if a man were able to give birth, we would have universal health care by now. But we don't. Because they don't feel it, they don't see it, so they disregard it. And they disregard the impact to women and the essential care that we need when it comes to our bodily health. That's why this legislation is so important. It would protect the fundamental right to access essential health care. It would empower women in Nevada and across the country to make decisions about their own lives on their own terms. And it would make it clear to anti-choice candidates like Donald Trump and his anti-choice followers that messing with the right to contraception is not on the table. My colleagues here and I will never stop fighting to reinstate the rights anti-choice politicians have stripped away from millions of women. And we will fiercely, fiercely defend the rights women still have, including access to birth control. That's why we are here today. I get asked quite often, what are you doing about it? This is it. There's a role for Congress to play, and we are doing it. But there's a role for everyone who cares about this issue, no matter your station in life, to do something about it, to advocate, to be a part of a solution or policy change in your state or your local community. There's a role for everybody and a responsibility. This is about women's rights. This is about women's freedoms in this country, and that is worth fighting for. Thank you, Madam President. I yield the floor.